Today, let's talk about two important drugs which are used as anti-tubercular agents, contrasting in nature by their action on enzymes, still causing the same hepatotoxicity. I'm talking about INH and Rifampicin. Let's talk about Rifampicin first. Can you see this black person with the orange pill on which it is written as sterilizing pill, and below it there are three subunits? I call Rifampicin the orange pill for a reason, because it makes sure that the urine is colored orange in color, or tears is colored in orange in color, or saliva is colored in orange in color. This is known to be one of the only drugs which kills the intracellular bacteria, the extracellular bacteria, and also the bacteria inspirtors. Now, let's talk about, taken orally, this drug colors the black color man into completely orange, which means the drug is well distributed. After that, you can followingly see this diagram where the person is orange below the head. This means once it is metabolized in the liver, the rifampicin also gets back into enterohepatic circulation and still stays back in the body, and some part of it is excreted in urine. Further by, I want to talk about an important property of it, that is enzyme inducer. Can you here see a person with green and purple color body structures? Purple being the oral contraceptive and green being the NNRTI. Now, when you're giving him the rifampicin pill, the orange sterilizing pill, it induces enzymes and it clears out the green color and purple color and makes the person orange in color, which simply means it induces a lot of enzymes to remove the green color and the purple color, or to remove the NNRTI or oral contraceptive or any other drug for that matter. Let's talk about the mechanism of action. Can you see here that I've written Seidel, and below that I've written this fact that it acts upon the DNA dependent RNA polymerase. Followed by its action on DNA dependent RNA polymerase, it inhibits the production of RNA itself, thereby taking out the genetic material of the bacteria and killing it evidently. Now let's talk about its uses. Before that, I want you to remember an important mnemonic called as influential men like Kohli or Pele. Well, it makes sense, right? Influential men like Kohli, like Virat Kohli or Pele. Here men will talk about meningococcus, influential will talk about influenza, Kohli will talk about E. coli or will talk about Staph aureus, and Pele will talk about Pseudomonas, and Ellie will talk about leprosy. So first let's talk about the infections. Now let's talk about its uses. The treatment. So it's used in the treatment of TB and also the chemoprophylaxis of TB. Along with that, I already mentioned about leprosy. It is used in the treatment of leprosy. After that, I want you to remember a specific code called as RND and R plus beta. The RND here suggests about rifampicin plus doxycycline, which is used in brucellosis, and R plus beta is rifampicin plus beta lactams, which is used for Staph aureus infections. I want you to remember this code, or else you can just remember it as Bruce works at an R&D laboratory. Followed by, I want you to also understand that 600 mg of it, which is given as a 4-dose regimen within the time span of 12 hours, is used for the prevention of meningococcus. After being said that, let's talk about the ADRs, or the adverse drug effects. Here you can see a liver which is converted into orange color, right? That will specifically speak about hepatotoxicity. And below it, I've written an orange flow colored in orange, which simply means that the person will have flu-like syndrome where he'll have fever, he'll have muscle pain, he'll have joint pain and conditions like that. Now, because this is a drug which is given orally, this is the sterilizing pill, right? So once you take that, it will cause GI symptoms such as nausea, vomiting, and pains. Then at last in skin it will cause flushing. You can observe it by seeing that there is red color between and there is orange color surrounded by it. Now, after completing about rifampicin, let's talk about INH. The interesting story about INH is that I want you to imagine INH as a bullet which is shot straight but takes a right and then goes and hits the wall. And not just does it hit the wall, it also pierces inside to do what? To cross the blood-brain barrier and to cross the placenta. Well, what does all this mean? So when I want you to when I'm trying to tell you that it takes a straight path and then takes a right, initially in the straight path it is a prodrug, it is given as a prodrug, but once it goes into the bacteria itself, it gets converted into the active drug and it pierces the wall. The wall, by that I mean, it is the one which acts upon the mycolic acid, which is an important component of the cell wall of the mycobacteria. After that, it also pierces the blood-brain barrier, and also the placenta is basically its way of living, or the way how it acts. It can cross the blood-brain barrier, it can also cross the placenta, right? After talking about that, remember I started the topic with the point that rifampicin and isoniazid are contrasting in their nature by the action on enzymes. Yes, rifampicin was what? It was a enzyme inducer, whereas this is an enzyme inhibitor. Our INH is an enzyme inhibitor, because of which there is toxicity of other drugs. That means that it will stop the enzymes from metabolizing the other drugs, because of which the drugs will increase in the blood, causing toxicity. Now the next diagram talks about INH being metabolized by acetylation. This is very important because the difference in the rate of acetylation is monitored genetically. There are some people who rapidly acetylate the INH, whereas other people do it slowly. So because of which there is different adverse effects. We'll talk about that in a few moments. After understanding how this bullet goes straight and then takes a right, understanding its mechanism of action, let's understand what is the use of it. Well, as we know, it is used for the process of treating TB. Also, it is also used for chemoprophylaxis of treatment of TB. But more importantly, I want you to understand a specific property about INH. So INH is, as depicted in the diagram here, is homologous to B6. So what happens is, because they are homologous, the body does not understand if it's B6 or INH. And when you're giving good quantity of INH, there will be competitive inhibition of B6, because of which INH binds a lot with the enzyme which utilizes B6, and the body starts losing a lot of B6. And once there is B6 loss, there will be peripheral neuritis. How? So B6 is known to be an important component for myelination of the nerves, right? So now because there is no myelination of nerves happening, because of which peripheral neuritis happens. Now that is a very important process. If you understand that, we'll talk about the adverse effects now. Talking about adverse effects, can you see this liver on which I've written as rapid acetylators? The hepatotoxicity because of INH is seen mainly in people who are chronic alcoholics, who are rapid acetylators and conditions like that. And if you discontinue it, things become back to normal. Like we know liver has a strong potential of getting back to its own state, right? Liver is a very resilient organ in our body. It can come back to its normal form even after so much of damage. So it can come back to its normal state after giving a lot of INH also. But yeah, it's all about the limit. Then let's talk about peripheral neuritis. So this peripheral neuritis is seen in people who are mostly slow acetylators. This is again a keyword which I want you to remember. So I've told you the mechanism by which peripheral neuritis happens. Then along with that, again, this is because of oral drug, you can see GI disturbances, you see anemia, you see arthralgia and conditions like that. There is another very important thing, as I told you already, it's an enzyme. What? It's an enzyme inhibitor. Now, after talking of that, I wanted to remember the specific dose regimen. So pyridoxine is given as 10 mg per day. Okay, first let's understand. B6 is pyridoxine, right? So when a person is having peripheral neuritis or condition such that, you will think of giving him B6 very simply because he has loss of B6. So what you do is you give him 10 mg per day. In alcoholics, so alcoholics get a 10 mg per day of B6, whereas people who are having peripheral neuritis because of INH, you give them 100 mg per day of B6. Well, don't be worried about the toxicity or something because of vitamins, because these are water soluble vitamins and they'll be excreted in urine. And this kind of summarizes the story of two contrasting people who still cause hepatotoxicity and still are the first line drugs of tuberculosis or treatment of tuberculosis.